So my name is Tarek Samour. I'm an Associate Professor of Colorectal Surgery at Royal Adelaide Hospital and the University of Adelaide. So there's two main groups of risk factors. There's baseline predispositions, things like age, family history, and certain types of syndromes that can contribute to developing bowel cancer, but also things like inflammatory bowel disease. There are also lifestyle factors, and these are things that are modifiable. So things like weight, the amount of exercise you do, and things like dietary habits. So for example, we know that processed meats, high-calorie foods, alcohol and tobacco use all contribute to the increased risk of bowel cancer. I think it's important to mention that not all bowel cancer actually has symptoms, which is why it's so important to be involved in the screening program. So particularly early bowel cancers and polyps, which are abnormal growths in the colon that can lead to bowel cancer, can be quite asymptomatic, so people don't know they've got them. If you were to get bowel cancer symptoms though, the common things are unexplained change in bowel habit, unexplained weight loss, but also things like blood in the bowel movements and anemia, which can be characterized by being pale and feeling tired. Having said that, those are not very necessarily specific to bowel cancer, so they can be associated with a whole bunch of conditions, but if you were to get symptoms from bowel cancer, those would be the common ones. If you're within the eligible age group, which is between the ages of 50 and 74, the most important thing is to be enrolled in the National Bowel Cancer Screening Program in order to pick up polyps and early cancers. Beyond that, it's about lifestyle factors, the things we talked about before. So plenty of exercise, healthy diet, which means low-calorie, low-fat diet and high in fiber. Exercise whenever you can, and reduce your intake of alcohol if possible, and don't smoke. Those would be the main things we would recommend. Beyond that, if there is a family history of bowel cancer, or if there are any unexplained bowel symptoms that you're concerned about, make sure you see your GP and ask about them. So since 2020, all eligible Australians between the ages of 50 and 74 have been invited to participate in the National Bowel Cancer Screening Program. So what that screening program involves is you get sent out a home testing kit by mail every 2 years. That includes instructions on what to do and a sample collection kit. And basically you have to send off 2 small samples of poo to a central laboratory that checks the sample to look for microscopic or tiny amounts of blood. If the test is positive, then you're encouraged to go on to the next step, which is a colonoscopy, to try and pick up polyps and early cancers before they get to the stage where they can cause symptoms. So it depends on which bit of the bowel the surgery involves, but generally speaking, what the surgeon will do is remove a segment of bowel, along with the fat around the bowel and some lymph nodes related to that, and join the other 2 ends back together again. And that join is often done either with sutures or with specially designed staplers to put the bowel back together again. These days, the surgery is commonly done laparoscopically with small cuts, or sometimes with a robot for the same reason. Occasionally, if the piece of bowel that needs to be removed involves other organs, then potentially the operation needs to be done with an open incision. Most patients stay in hospital afterwards. What I tell patients is once they no longer need an IV and they're eating and they're not needing IV pain relief, they can go home. And that can be anywhere between 2 days and 2 weeks, depending on how quickly the recovery is and the size of the surgery. I also tell patients that it takes about 2 months to fully recover back to sort of the usual energy levels and physical activity levels, because it is quite big surgery. It's important to mention that while it is big surgery, the success rates are fairly high. So for example, for something like bowel cancer, the cure rate from surgery is about 80% and improving all the time. So while it is big surgery, it's often well worth it for most patients that undergo it. So a colonoscopy is a day procedure which involves a doctor, usually a surgeon or a gastroenterologist, having a look up the bottom with a telescope and checking to make sure that there are no polyps or cancer or other problems in the colon. The way it usually works is we send you out some instructions, dietary advice and certain laxatives to take to empty the bowel out, and then you come into hospital for the day. You have sedation or sometimes a general anesthetic. Sedation means that you're sort of half asleep, half awake, but usually it's very well tolerated in most cases. Occasionally there needs to be a full anesthetic where you're completely asleep. Once you're given the sedation, then the doctor will have a look with the telescope all the way around the bowel. If we find any polyps, then we can often remove those at the time. And if we find anything like a cancer, then we talk to you about that afterwards and make a plan as to what the treatment may be afterwards.